Medicare, I feel like, is really where my heart is. And so I felt like developed a love of seniors. And honestly, Medicare there's no pre-existing conditions. They don't look at anything like that.
Anna Regina!
Thank you. Thank you so much.
You get.
Oh my gosh, the magic wand.
Yes.
Yay.
You don't have to hold on to it.
I love it though. That's cute. Well, hi. So my name is Anna Regina. Thank you so much. First, I'm so excited to be here with all of you today, and thank you to JoAnna and team for having me. So I have been a health and life insurance broker for over 6 years. I think I'm in year 7. And I have a special place in my heart for Medicare. I do work in life insurance and also under 65, the ACA and healthcare marketplace. I have a few other things as well, travel insurance, all of these things. But anyway, Medicare, I feel like, is really where my heart is. I was a stay-at-home mom for 12 years with all of my 4 children, and at the time when I decided to go back to work, I started working in retirement living. So I worked in activities in a retirement center, actually not center, retirement living at Fellowship Square over off of Broadway and Pantano, if that sounds familiar. And so I felt like developed a love of seniors, and I saw so many that needed help in so many ways with living and daily expenses. And so when the opportunity was presented to me about being a health insurance broker and the Medicare world, I decided to take it. So that's where I've been for the past 7 years, and I really enjoy what I do. So yes, today I'm here to talk about, I realize I set up the presentation more for Medicare and healthcare marketplace changes for this year. But there probably are some basic getting started with Medicare questions that some of you may have. So I thought I would probably touch on that first, and then we'll dive into changes for this year, just because that is a subject that is, some people might have questions with. So I handed out the United Healthcare booklet, and realize I don't have one. But if you open it up, you'll see that on the I think it's page, I'm going to go grab a booklet. Yeah, I was going to go grab one for me. Thank you. If you open it up to page 4, and this is just a basic, just to get started so people understand. If you open it up to page 4, this is probably my most favorite Medicare educational tool, because it really talks about the basics and shows you what your options are and breaks that down. So when you first turn 65, or if you're on disability, you're able to get Medicare early, then you would be able to get Medicare Part A and B, and you apply through Social Security for that. Part A is your hospital and inpatient care. Part B, doctor visits, provider visits, and outpatient care. And this would cover 80% of your coverage. And then where the big question comes in, all of these plans and all the things that you're seeing on TV and getting mail would be these options down at the bottom to help cover the 20% that Medicare doesn't cover. So I just wanted to break that down to get started, so you just kind of have an understanding that it's always an 80-20 situation. So 80% Medicare, 20%, whichever option you decide to go with. So just to start with that, so if you have basic getting started with Medicare questions, and when you look at option 1 or option 2 for that 20%, they both work different. So we have a Medicare supplement, option 1. Option 2 is a Medicare Advantage plan. And so both of those types of plans work different, and they have different rules, I guess, for when you sign up for those and how those work. Mm-hmm.
Is option 1 also called Medigap?
Yes. So it can get confusing because I was just speaking with someone about this. They call it a Medicare supplement, but actually both of these options, 1 and 2, supplement what Medicare doesn't cover. So they are both a supplement in a way, but option 1 is called a Medicare supplement or a Medigap plan. So if you hear those terms, just to give you some information.
So it's either option is your gap.
Yes, both of them fill in the gaps of what Medicare doesn't cover and supplement what Medicare does not cover. So it's 80% Medicare, 20% on either type of plan.
To clarify, so when people say, oh, I have Medicare, but I have a supplement that I pay extra for to cover the 20% Medicare doesn't
It would be
cover.
option 1.
Option 1.
Yes.
What about option 2?
So I'm going to explain that right now.
Okay.
So option 1,
That was the topic coming on.
option 1, a Medicare supplement or a Medigap plan. This is a plan that you pay an upfront premium for every month, whether you use the plan or not. You pay a premium based off of your age and where you live, and every year those premiums go up. So I would say maybe an average premium to start with could be $150, but it really just depends on where we're at. And once I put the information in, it would generate a quote for that. But you pay an upfront premium every month, whether you go to the doctor or not, it's always there. And that would just cover medical side of your coverage. And so with that, on the option 1 side, then because you have to have a drug plan in place, if you don't, let's say you don't take any prescriptions, and you're like, I don't take any prescriptions, I don't need a drug plan. Later down the line, the government will give you a late enrollment penalty or a fine for not getting drug coverage right when you turn 65. So you do have to have something in place to just, to have that idea in the back of your head, because I do have a lot of people that will tell me, I don't take any medications, I don't need it, but it's good to just have it. So option 1, we would do a Medicare supplement and pair that with a prescription drug plan, and that would cover you for 20%. You'd pay upfront premium, and then every year the premium goes up a little bit. But the advantage to having one of these types of plans on the supplement would be that you can go anywhere that takes Medicare. You do not have to have a network. You don't have to worry about getting a referral or anything like that. You just can go. If they take Medicare, you can go. One item about these supplements, the Mayo Clinic only takes a Medicare supplement. So if somewhere down the line you would like to go to the Mayo Clinic, you would have to have a Medicare supplement to be able to go. Yes.
I have Federal Blue Cross Blue Shield.
Okay.
Medicare.
Okay.
So it's really not just a supplement, because it pays for surgeries, it pays for everything. It pays for wheelchairs and lenses.
And that's actually the beauty of having a Medicare supplement, is you pay this premium, but and there are different types, but for the most part, you pay an upfront premium. There's a small deductible on those plans. For this next year, it's $257. So once that deductible has been paid, then you most likely would not have co-pays. So you could go to the hospital, you could have a surgery, you could do whatever you need to do, and you would not have a copay. So that's a nice option of a supplement. Yes.
So you said that what you pay every month depends on how old you are, where you live. Is the deductible standard no matter where you are, how old?
The deductible is it's all across the country. It's the exact same amount of money. That is set in place from Medicare itself. CMS is the Center for Medicare Services, so they put those rules in place.
I need to have an example for option 2. We all have Medicare if we're enrolled at 65, even though we're not. Option 2 example would be United Healthcare Advantage Plan.
Yes. Yes.
or one of the others.
Yes.
And United Healthcare, which is what I have, as a hospital or whatever, we $2,500 a year before they cover. Do they cover? Where does 100% get covered?
So we're going to get to Advantage plans next.
Okay.
So we'll talk about those. Okay, so that's what is supplement. That's the beauty of the supplements. And then, oh yes,
Question before
yes,
we move on.
yeah.
What are the cons of this one?
So the pro is that you can go anywhere that takes Medicare. A con, I feel like, can be that they can be expensive. Because if we go back to Medicare Part A and B, Medicare A, you do not pay anything for. Medicare Part B, there is a premium that you have to pay. If you're collecting Social Security, it just automatically comes out of your Social Security every month. You wouldn't even know it was there. If you're not, then they bill you quarterly. The amount for Medicare Part B for this past year has been $185, and we've heard rumors that it's going to $205. So that is the projected 2026 amount for Medicare Part B. So a con for a supplement could be that if you're already paying the $200 for the Medicare Part B, and then you add a supplement that could be $150, they start to get expensive. And so that's where I will find sometimes over time, a lot of individuals might like to get them at the beginning because they go up every year. So maybe 5 years down the line, they've gone up 7 or 8% every year, and you're paying both. It could get kind of pricey. So that usually is what I find at that point is the con, that they just can be so much more expensive.
I know you're getting
So-
bombarded with
Yes, that's okay.
So the supplement. So
Yes.
You said that Part B gets taken out of your Social Security automatically if you're collecting Social Security. What about the
Yes.
supplement? Is that also taken out of your Social Security or?
So that you actually pay directly to whichever company or carrier that part or the supplement is with. So let's say you have a United Healthcare supplement, then they will either do an EFT or send you a coupon book and you pay them directly. So this part, and that's where it gets confusing. Social Security and Medicare work together, but then they work separate. So they work together on getting your Medicare set up, and you get going smooth, but then and then they take the payment, but then once you're on Medicare, any questions with Medicare, you go to Medicare. So they're together but separate, so.
Now, I'm totally confused.
Oh no, okay.
I get my Social Security
Uh-huh.
check, and my supplement for United Healthcare is taken out
Okay.
of that amount. So what about Medicare? Where does that fall into place? Or is that, do I have United Advantage?
Yeah, and I guess I didn't go to Advantage quite yet. So if you are on an Advantage plan, option 2, this is probably where you're seeing all these advertisements right now and getting the phone calls. It's mostly on these Medicare Advantage plans and on the carriers, because there is a big competition right now in the market. They're all competing with each other. We're in the middle of the annual enrollment period, and so it's big time. But the basics of a Medicare Advantage plan is most likely you do not pay a monthly premium. So these, for the most part, there are a few out there that have a premium, but for the most part, it's a 0 premium. So you're only paying that $205 that was Medicare Part B on an Advantage plan.
Assuming you don't have to pay earned.
Right, and we'll get to that point. Yes, and so for the most part, Medicare Advantage, you're just paying your Part B, whatever that is, and then you don't pay anything additional for the plan. This also includes dental, vision, hearing, most of them have over-the-counter, and your prescription drugs. So they're all together in that Advantage plan. But the IRMA, so depending on what your income is, there is a higher Part B charge for someone or a married couple. And there's a chart. I can look it up and I can give you the specific amounts. I don't have that with me right at this moment. But if you go beyond their threshold, then your Part B could go up. And it really just depends on where your income is. If you're single, if you're filed jointly, that all kind of comes into play. But that would tell us, they call it an IRMA, which is the income-related Medicare adjustment. So that means your Part B is higher. But just off of the two types of plans, the Advantage plan most likely is 0. You have all those other services included. But a con for the Advantage plan, and it really just depends on what your needs are and how you like to have your health insurance coverage. A con could be that you might have to get a referral for a doctor. Some of the Advantage plans require referrals, some do not. And then also on these, let's say you're in skilled nursing. Maybe you've been in the hospital, you've had something happen, and then you go to skilled nursing before you go home, and they start to call and try and find you a skilled nursing to place you in. If you're on an Advantage plan, you might have a smaller, fewer skilled nursing facilities that might take that, and you might have to go with some place that might not be your first choice. Because yes, and it just depends. And so that's where it kind of just depends at that moment. You would still have coverage and you would still be taken care of, but it might not be your first choice because they might have to see if it all depends on if they accept your plan.
And don't these Advantage plans charge the government a lot more money cost them a lot more money than straight Medicare?
Well, I think that what it is based on is you've paid into Medicare your whole working life, so you've already paid into it. And then the contracts with the insurance carriers and the government depend on every year they're renegotiated. So actually the government is paying a certain amount of money to these insurance carriers to have you. But I think it just works differently than the contracting for the Medicare supplement. Because on this end, so if you'll notice when we start to get into the changes for this year, some of the reason why the costs have gone up and there are changes is because the utilization has gone up on the plans. So I've been told, so every year we recertify, we do testing with all the insurance carriers, and they've all basically said the same thing. Costs have gone up because during COVID and around that time, people weren't using their plans. They maybe needed a surgery, they were putting the surgery off. So all of a sudden, the plans have so much usage because everyone's using them again. And so that has really caused a lot of the costs to go up. So we'll get there when we talk about the changes, but yes, do you have a question?
Yes, I just wanted to just clarify something. If you're new to Medicare and you originally sign up for option 2, but then want to change to option 1 the next year, the year after, is that possible?
So, good question. So option 1, when you first turn 65, so first I'll back up, you have a 6-month window to sign up for Medicare, 3 months before your birthday to 3 months after when you turn 65. If you are someone that is still working, then we usually recommend you sign up for Medicare Part A because that you're not paying for. And if you have a group employer plan, then you don't need to add more expense. So you sign up for Part A until you're ready to come off of that employer plan and go just on to Medicare. But also, if you were, let's say you decided to do a Medicare supplement, the time to really get these is when you just turn 65. Because they give you something called a guaranteed issue. That means there's no health questions, they don't ask you anything, you're 65, you apply for the plan, you get the lowest rate, and you're good. If you try to get option 1 later on down the line, maybe you've been on Medicare Advantage for 2 years and all of a sudden you think, gosh, I kind of like that other plan, they would put you through health questions and underwriting to be approved. So you would probably be approved, but they go back 5 years. So let's say maybe you went to the hospital with chest pain, or maybe something happens. If they approve you and you've had health, if you have had health issues, they would rate you higher and charge you more. So I've seen this happen before. I had a client, she had only been on Medicare Advantage for maybe 2 years, and she's thinking, well, you know, I saw a friend get sick and her supplement, she didn't have any copays, she was happy with it. So I'd like to try that. So then we go and we do an application. When we discussed, she forgot she had gone to the emergency room with chest pain at one point in time, and they prescribed a medication. So that was sitting back in her health history, and she really didn't even think about it because she was fine. Well, that showed up on that underwriting, and it's very similar to life insurance. So it shows up on the underwriting, and then it comes back, and she probably, where it could have been $150, I think they said her plan would be $450. So it is a big jump. It really is a big jump. So I tell people, if you're thinking about option 1 at 65, try it for a year. See if you like it, and go as long as you can if you can afford that. If the cost is something you can't afford, you will be covered on a Medicare Advantage, and that's okay. But if you're thinking about option 1, it's good to get it at the beginning.
Can I just make a comment?
Yeah.
And just say that, and I already know you're exceptional.
Oh.
Because number one, you're the only person in all these years I've gone to some of these that talked about how option 1 is the only one that takes Mayo Clinic. A lot of people don't know that, and they're just stunned when they find that out. And the other thing you mentioned, which makes you exceptional, is that the comment you made about the limited choices you have in rehab transitional facilities diminishes quite a bit with the optional too. And that is usually critical when you're transitioning out from surgery.
Mm-hmm.
You have to go home, but you can't, so you have to go to one of those facilities, which a lot of them are not very good in the city.
Yeah.
And so I just wanted to say thank you for being here, and
Oh, thank
very
you.
much to what you have to say.
Thank you so much. I appreciate that.
I missed the beginning of what you stated.
She's accepting.
Thank you.
Face is not working.
Thank you.
I'm sorry.
Thank you.
So, my sister signed up last year.
Okay.
And she got a supplemental plan.
Mhm.
She lives in North Carolina. but
Okay.
Blue Cross Blue Shield. And it's the only one in all their plans that she can switch back to regular Medicare without question. You don't have to do the application, and you have the same fee everybody else pays.
Oh, to go to a supplement or just original Medicare?
She has an option 2.
Oh, starting an
And
advantage.
she can go back
Right.
anytime to option 1 without question. She doesn't have to fill out.
That's really interesting.
Yeah,
I'm wondering.
Ship told her that.
So it's really interesting. I will say, let's say that you start on a supplement, because I will tell you, I had this happen last year with a client. She is in her 80s. She and her husband live in an assisted living facility. I went to see them. She has some health conditions. She had Parkinson's, and she was like, you know, we're spending a lot of money for my husband right now. He's very ill. I'd like to go off of my supplement and be on Advantage. So I always go through all the things, because my big thing is I want to educate everyone so they truly understand what they're doing. But Medicare will let you leave your supplement and try an Advantage for a year. If you're not happy, you can go back. So that's exactly what happened with her. Her husband passed away recently, and the family called me. I went and met with them, and she's like, you know, I like the Advantage. It was good, but now some of my expenses have gone down. I'd like to go back. So that we're in the process during the enrollment period to do that for her. But they let you try it for a year, but I have not heard of being able to go back without question. But that's interesting. I actually would like to know more information about it because I haven't heard that before. But yeah, because usually the supplements do go up every year. This past year, we probably saw a 15 to 20% increase. In the years past, it had always been 7%, 8%. And it made sense because they say that it's not because of as you age, but it makes sense. As you get older, the cost goes up a little bit. You're probably using the plan more. But this year it was about 20%. So they did go up pretty pretty much this year, and I think it is just like the same thing with the Advantage plans, is they're trying to recoup some of that money. So any other, oh yeah.
I'm going to go on and start my.
Oh yeah, go for it. Because I have a, yeah.
So when you have credible coverage.
Yes.
When you're 65 and you have credible
Yes.
coverage through your employer.
Yes.
Does the supplement premium?
Yes.
Extra premium still apply even if you've had credible coverage, including drug coverage throughout your.
When you're 65? So, okay, so if you turn 65 and you stay on your group employer plan and you add Medicare Part A, I would say not to add B because you don't need to pay it.
Right.
If you add A and you have credible coverage, so that means your employer plan, they do have, Medicare says that you do have to, after you turn 65, have credible coverage, which means your prescription drug plan has to be equal or better than the Medicare prescription drug plan. So that's what they call credible. They don't want you on a discount drug plan saying, oh, I have a drug plan, because then they would come back and say, actually you didn't. Because what happens is when you go to add that Part B, there is a form that you have your employer fill out, and you submit that with your Medicare Part B application, and it asks, what coverage have you had, for how long, and they will review that. And so as long as you've had credible coverage at that time, once you add the B and go on to original Medicare, you could go on to the supplement as a guaranteed issue because you were just starting a Medicare plan. If that's the question, did I answer the question?
I just wanted to make sure that
Okay.
the increased premium.
Oh, so, well, actually, you'll still get that guaranteed issue premium because we do put the age in. So we would put your age in, we put your birth date in, and it all is based on county. So we put your age and your county in, and then it would give us a premium. So it would probably be, it depends on how long it's been since you've turned 65. So it might be a little bit more than it would have been when you turned 65, but you wouldn't have the health underwriting questions.
Right, and that's, I mean, it's not for me, I could care less right now.
But exactly, but that's,
My husband cares.
but see, but that's, and so that, but those are the good questions to ask because you don't want to, yes, and then another thing, while we're talking about this, is if you're leaving, let's say you're leaving group employer coverage and you have an HSA. This is something that you also need to think about because I've seen this so many times where someone will come in, they're like, I'm retiring in 2 months, I want to add my Part B, I'm ready to go. And we start to go through and they've had an HSA. So they say that you should stop contributing to your health savings account or your HSA 6 months before you're going to go on Medicare because there are tax ramifications from that. Now, let's say you leave that health savings account, you have $10,000 in it. You can still use it once you go on to Medicare, but you can't be contributing and be on Medicare. Yes, yeah, so there are some rules with that. So if that's ever, it just depends. If you're still working, you're thinking about retiring, thinking about going on to Medicare, you do have to think about that HSA. So that can sometimes, it's a tricky one that people don't realize is out there.
I just have a suggestion. If you're turning 65 or going to turn 65, to go ahead 3 months ahead
Mm-hmm.
because Social Security is short of help.
So,
And
yes.
If you wait for the other 3 months, they aren't taking phone calls, they aren't doing anything, and you have to go in, and you'll get in trouble.
So in the past, when I've helped, so I do help people. We will go on to ssa.gov, we will start your application, and then we submit that to Social Security, and then they would send your paper form to you, have you sign it, and I would tell people, just go drop that back off or put it in the mail. And you could get a walk-in appointment. You cannot do that anymore. This happened this past probably 6 months. There's no more walk-ins, and it is harder to get in touch with Social Security. So I usually do tell people, yes, you have a 3-month window, but let's do it earlier than later. Let's say your birthday is in December. I would say let's even start talking in September to get ahead to plan out what you want to do, because then as soon as the time comes that we can apply, go ahead and do it, the Medicare still will not be effective till December 1st. It will not be effective till your birth month. So it is good to really start thinking about that. And sometimes I'll meet with people a year ahead. You know, they're 64 or 63, just to kind of start to get that process put in their brain of what they need to do.
But especially now.
Yes. Is there any more questions?
Yes,
Okay.
not to offend you, but this side of the room, I think, is having a hard time.
Oh, hearing. Oh, I'm so sorry. Okay, I will step back. Sorry about
We're
that.
the elders.
I'm sorry about that. Okay, and I'll talk louder. So, yeah, so this is just, I wanted to go through this because basically I brought a lot of information in about the changes for Medicare, but I did want to really start with this just so then you have an understanding of how it all works. And if you have particular questions, I'm happy to answer those again at the end or after. So, yeah. And I am going to talk about Marketplace today too. So if anybody's on the healthcare marketplace, not quite onto Medicare and has questions about that, that's something as well. Are we
I
good?
have a question.
Yes, hi.
For Zoom. Hi, thank you. I'm 75 and still working, so I'm at the university. So
Okay.
I'm still on the university plan. And I'm just curious, like, do you help? It seems to me that perhaps there are some options for retired university employees versus Medicare, or am I not understanding that?
There are. So usually what I will do with that is we will sit down and I'm assuming Arizona State Retirement System.
I'm on TIAA crap.
Oh, no. Okay. So usually what I do is we will sit down, we will find the benefits for that plan. There's a lot of ways I can research and I can find those benefits. I compare them to a Medicare plan, the two different options, and then what we do is we really just see which is the most cost effective for you. So it really just comes down to what benefits are the most important to you and which is most cost effective, because I've seen it go both ways. I've seen some retirement plans, they even pay your Part B. They pay everything, and I tell people go that way because that's going to be best for you. And then there's some that you have a high deductible or something like that, and the Medicare plans, on the Medicare Advantage plans, there's no deductibles, and the deductible on this option one is low. So those are the type of things we look at just to see.
But it's not a problem that I'm still,
No.
that I transition.
As long as you have that credible coverage and it's equal, if you have prescription drug coverage and it's equal to what Medicare has on the market, then you would be okay.
So she's still employed,
Okay.
and so she's got A, she doesn't need B because she's got.
Yeah, so she's not, yeah. So if you don't need the B because you don't need to pay for it. So yeah, I would think that you would be all taken care of.
So I'm good just with A for a while.
Yeah, as long as you have that employer plan, plan, you don't have to worry about it.
But if I need to transition, I need what, about 6 months, or to kind of think about that, or like how much time do I need to get?
I
transitioned?
would say probably 6 months to really start thinking and looking at options. But to add the Part B, we actually don't do that for maybe 6 weeks ahead of time, because we are dealing with Social Security when we do that. So we just don't know quite how fast they're going to do it. But if we do it too early, then it will be effective earlier than you really want it to be. And it really just comes down to you're paying more money that you don't need to pay. So I would say about 6 weeks on the Medicare Part B. When it's time. Yes. Yes. Okay, any other questions? Is everybody understand? Is it making sense?
Sorry, one more thing.
Yeah, no, go for it.
So when you're talking about Part A.
Yes.
And you're not taking Part B.
Yes.
There's a, train of thought was going. I'm old, I have mine.
No.
But when when you're talking about switching from a group employer
Uh-huh.
going to the Part B, is there not some issue that comes with the employer in terms of, there's something, I can't remember, there's a difference between Part A coverage becomes primary for larger groups, larger group coverages, like the University of Arizona would be an example of that.
Mm-hmm.
But it becomes secondary coverage. Part A becomes secondary hospitalization coverage for smaller groups.
That I would actually have to do research on that one, because I have not come across that before.
I think, because I'm helping employees get
Right.
transitioning.
Right.
And when we do, and when we're going through all those forms, which I don't like, but I'm doing it. When we're doing that, they're showing, it's like, if you have a group, I think it's 50? Group of
50 or less. Mm-hmm.
That
Like Part A is in
Part
the
A
mix.
Part A becomes, for smaller groups, Part A becomes secondary insurance.
Mm-hmm.
And your group coverage becomes your primary insurance for hospitalization. But
Mm-hmm.
if it's a group that's a bigger group, Part A becomes primary
Mm-hmm.
and your group insurance
It's the opposite.
becomes secondary.
I will research this, because I have not come across that one before. That's a new one. That's a good question. I will research it and find out. Yeah, thank you. I need to know this. So, yes.
Basic.
Okay.
Client comes to you for the first time,
Okay.
turning 65,
Okay.
going on Medicare, and says to you, what should I do? What would you recommend is the best plan? And I'm not expecting you to listen.
Oh no, so here's what I'll do. I have a process. So here's what I do. I have a client intake form. I have everybody write down your prescriptions, your doctors, address, zip code, birthday, all of that fun stuff. And so what I do is I go back to my computer system. I put in all of your providers. I put in all of your medications. And then, so I am contracted with 11 different insurance carriers. So I put in all of your information, and it basically comes up, and the first thing that I look at is who are your doctors contracted with, because that is the most important thing. When I will tell you this too, right off the bat, is as health insurance broker, when I meet with someone, there's no cost to the individual to meet with me. That's free. And the way we get paid is through the insurance companies. They pay us all the same amount of money. So United pays the same as Humana. So there's there's nothing out there saying, well, if you go this way, it's better. So I look at your doctors, I look at your prescriptions.
Go ahead. Add a layer.
Okay.
Drasticness. In today's society, I'm finding a lot of doctors that you use today are not there tomorrow.
Mm-hmm.
They've gone concierge. So I'm taking the doctors out of the mix.
Mm-hmm.
And what's left is hospitalizations,
Mm-hmm.
drugs,
Mm-hmm.
and God knows what else.
Well, and so honestly, when I meet with someone, it's all about what they want and what's the most important thing for them. So if you were to come in and say, okay, I go to a concierge, and I do have clients that have concierge doctors, so we don't even deal with that, but we might want to look at your specialists and other people that you want to see, because even though you go to a concierge, they might refer you to a cardiologist or a dermatologist, and those are things that are still important.
There's no plan out there that, of course, covers concierge services. So,
Yeah.
which is the most cost-effective plan? Forget about the doctor.
Well, so here's the thing. It really just depends. It really depends on what, and I can talk to you after, and we can look at what you have. So each person, it really is just it's tailored for you. But that's how I do it, because I want to make sure prescriptions, doctors, all of that is covered. Because yes, the concierge, that is a big thing right now. And I have a lot of clients who have their Medicare plan and have a concierge as well. But at some point, you will most likely have to go to a specialist or have to go to an urgent care. And so we need to make sure that that is...
So would you be able to just look at the drug list forgetting, because
Yes.
specialists change also, they're not always there.
Right, and so I'm going to start talking just about the changes because those of you on Medicare, I do want to talk about this so then you can get an idea. So I just, want to make sure. Oh, we got our little arrow here. So I have my little presentation up here, and it's really focused on the changes for this year. So as we go, I'll kind of go through this, and then at the end, I'll do any questions about changes. And if there's anything personal, yeah.
He's trying to answer a question if you mouse.
If you mouse it,
Oh,
Yeah, I'm just responding to somebody in the chat.
okay. Uh-oh. Oh. Copy of, oh yes, I will email that. I have an email of the handout. I can definitely do that.
now you can.
Okay, oh, he's got the thing. What am I doing? I thought I could do that too. Okay, so here we go. And like I said, there's a lot of information, lots of things in here with some of the changes. I can talk to you, we'll do questions and answers at the end, and then I can also answer any personal questions you might have as well. But the first thing I wanted to really talk about is the key Medicare updates for 2026. So if you're on Medicare right now, getting ready to go on to Medicare, these are some of the hot topics for this next year. Oh, thank you. Key Medicare updates for 2026. The first thing I wanted to really talk about is prescription drug changes. We also have premiums, deductibles, Medicare Advantage benefits, and some prior authorizations. But okay, so we can go next. So what's changing for prescription drug PDP, prescription drug plans, whether it's your Medicare Advantage or an individual prescription drug plan? The Inflation Reduction Act 2026 actually will take that back to 2022. That's where Medicare actually was starting to negotiate drug costs with these insurance carriers to try and lower some of the costs for everyone. So in that act, what they did, if you had ever heard of somebody talk about the donut hole or the coverage gap, has anybody maybe even been in that before? Before, the way that the drug plans were put together, you had to reach a pretty high amount in drug costs before you were kind of out of your maximum out of pocket. That's the best way to talk about it. But now what they've done is they've reduced that amount. So if you were to pay $2,100 in your drug cost, then you reach an out-of-pocket limit and you wouldn't have to pay anything else. So that's part of this Inflation Reduction Act. Also, vaccines are now included. And also they've reduced cost of insulin. It should be $35 a month. And they've also done payment plans. So let's say someone comes in, they have a very high prescription and they just cannot afford. My favorite one to talk about is Eliquis because it is very high. And so let's say you have to take it, there's no generic for it, and you can't afford it. There are payment plans that Medicare has put in place to be able to help with those costs. So that's the Inflation Reduction Act, and basically for this year, it's helping to lower cost of drugs.
It's a blood thinner.
A lot of words to say that. Deductibles. So PDP, a standalone prescription drug plan versus an Advantage plan. So in the past, the Advantage plans they did not have a deductible for prescriptions. This year, a lot of them do. So I would say that's a key thing to look at when you look at your plans for this next year. What are the deductibles on your prescriptions? What that is that's an amount of money you would have to pay before you would be able to pay your copays. The deductibles are always paid up front on top of your drug cost. So that's another change for this next year. It really depends. I've seen, so some of the Advantage plans, there's one that does not have one, but there's some that start at $200 and some of the deductibles go up to $400. So it's really an important thing to look at when you look at your plan.
Per drug.
Oh, the deductible would just be for all of your drugs in general.
Per year.
Per year. And it also is based off of if you have, all the prescriptions are in a tier system. So tiers 1 and 2 are usually preferred generics or generic drugs. Those most of the time do not fall into this deductible. It is usually a brand name drug or higher. So it just really depends on what you have. So I would just say, when you get your plan information for this next year, really look at that prescription drug part to see where you're at.
So basically, tier 3 would be the
Tier
best.
3 and up is usually higher cost. And then copay or coinsurance. This is another thing. In the past, the drugs have all been on a copay system. Some are on a coinsurance this year. So again, when you get your plan information, just really look at the prescription drug plan if you're on an Advantage or a prescription drug plan. And if you need help, someone like me can help you walk through that just to understand what those costs are. But I just don't want anyone to have surprises. So make sure that you look at your drug costs this year. And then next is premium. If you're on a Medicare Advantage plan, then it's all bundled together on your Advantage plan. But if you're on a standalone prescription drug plan with that supplement, actually the premiums most of them have gone down quite a bit. So look at your premium costs on that. So that's pretty much in the prescription drug area, the different changes for this year.
And that's when they sent, like my insurance company, United, sent me
Your notice of change. Mm-hmm.
for the upcoming year. And in that information should be listed.
Yes, that's where you should look at that.
And I should have a
Oh.
cardiologist.
Okay, next. So, I like it. I might have to get a wand. I like the wand. So next, Medicare Advantage plans. And I don't want to overwhelm you with information either. I just kind of pointed out a couple issues or things to look at on each type of plan. Medicare Advantage plan, some of the new rules are there are plans for people that have chronic conditions. Or there are plans for people that are on Medicare and Medicaid. It's called a dual plan. Some of those rules have changed this year to where you have to go through paperwork up front to prove this chronic condition at the very start of the year. So if you're on one of those plans, it's something to think about, just to know that that's coming. And they basically give you paperwork, take it into your provider, they sign off on it, and you send it back to the insurance company. But that won't be for everyone, but I just wanted to point that out, that that's something that's different for this year.
Every year.
In the past, you would prove your chronic condition.
Chronic is chronic, so if I've proven it once, why would I
If
have
you-
to prove it again?
Well, this is new this year, so this is a new thing. But I think once you're on it, you should be okay. But I know for this year, all of my clients that were on them in the past, they had them all resubmit paperwork this year. So it's something that's new. I don't know for sure if they're going to have you renew every year or if they just did a refresh for going forward. And then one good thing when we were talking about doctors leaving, this is a nice improvement. So accurate provider directory data and CMS. So CMS is the Center for Medicare Services, and they have now come down to the insurance companies and said, your provider directories need to be right. Because what will happen is sometimes people will enroll in plans. An agent like myself will sit down, we go through all the doctors, we look at all of it, and then 2 months later someone goes in and their doctor's not in network anymore. And then, once you're on a plan, we can always change your primary, but we don't want you to have to do that. So the Center for Medicare Services has come back to these insurance companies and said, those provider directories need to be updated and they need to be correct. So it's actually a good thing.
Is there a listing of chronic illnesses that?
There is a list.
There is?
There is a list. There is a list.
Where would you find them?
I can show you when we're done. I can show you the list. Yeah. Because I know for me, I can see it on the insurance carriers' websites, but I don't know if Medicare has it listed or not. But
I have United.
yeah. So
And I have COPD, so is that considered chronic?
So for chronic conditions, they usually talk about, there are some lung condition plans, but for most of them, it's diabetic plans or heart disease. Those are the two that they mostly cover or mostly have extra plans for. But I think there is one carrier that does have a lung plan. And then next, referrals. In the past, most of the Advantage plans had gone away from having a referral. Some of them this year have brought referrals back. So as you're looking at your notice of change and you're checking all of your plan information, that's something that is important to look at, because I don't want you to have any surprises if you try and go in and all of a sudden you need that referral. It's not the end of the world. Once you get a referral, they're good for the year. It's not that you have to continue to keep doing that. But let's say you've gone to a cardiologist for 5 years without a referral. You walk into an appointment in 2026. They're going to say, well, your insurance company is not going to pay for this until you have a referral. So just check, make sure, and if you need them when you have your yearly visit with your primary, have all your referrals set up for this next year. And then extra benefits, that could be your vision, dental, hearing, and possibly over-the-counter, possibly a gym membership. Most of the plans include all of those items, but that really is where they vary. Some insurance companies might give you $3,000 towards dental work. Some might give you $500. And then over the counter, they usually will give you a card. Some of them it's your actual insurance card. It has the barcode, and you can go into CVS and buy over-the-counter items for whatever that amount is for the year. So that's where it just really depends on which plan you have, but make sure, again, as you're going through that information, you take a look so you know what is happening. Because especially, I'll say the dental can change. One year they'll say, oh, you've got $5,000 of dental. You can use it wherever you want. And then the next year they'll say, oh, well, you have $5,000 of dental, but you can only use 50% per service. So, you know, just to really have an accurate idea of what those look like. Okay, we can change. Oh, yeah.
I'm sorry if I'm being.
No, you're, no.
But, when you said this is where different plans really differ, I thought Medicare Advantage was just like the plan we were talking about. Are there different plans?
Okay, so that's my fault. I should have explained that. So under both of those options.
So I just said that I thought that we were talking about Medicare Advantage and that Part C was under that. So I don't understand what the different plans are that she was referring to.
So option 1 and 2, and I should have explained this better. Both of those, that is the type of plan. Option 1 and option 2, those are the types. Under both of those types is an umbrella of companies. So that's where you have like option 2 Medicare Advantage. That's where you'll have Humana, Cigna, Aetna, United Healthcare. I mean, there's probably 10 to 15 carriers under each of those options. So I like to just basically educate on this is option 1, this is option 2, because there are so many options under that umbrella. And that's where, when we compare your doctors and your prescriptions, we figure out which plan or carrier is best for you out of those options.
What's the difference?
Well,
If you can give me an example of each option, that would help.
each option. Well, so the option 1 is the supplement, option 2 is the Advantage, but you mean like with the companies?
No. Okay, so option 2 would be like United Advantage.
Yes.
Okay. Option 1 would be.
United Healthcare has a Medicare supplement. Humana has a Medicare supplement.
Okay, so there's a difference between a Medicare supplement
And the Advantage.
there, okay.
And so
that's
they,
different.
yes, so they both are types of plans, option 1 and option 2. And then they both have different insurance companies offering those
And
plans.
okay, and both of them have different premiums?
On the option 1, on the supplement, all of the different companies that offer that supplement will give a different premium. And that's where it gets a little confusing.
That's where my initial question.
Yes, so
was,
that's
okay.
where it gets confusing.
Give me an example of
You said they would
option.
have different premiums? What is-
So if we're looking at option 1, they can have different premiums. They have to cover the same coverage. So they have to cover the same, the plans have to be the same as far as you pay your premium, you don't have a copay for your doctor, or so that type of thing, the coverage is the same, but they can be different in price. So that's where I come in and we look at all the prices, we look at all the costs, and we say, okay, so this plan is this much, this plan is this much. Which one is the best fit for you depending on the cost? So yes, that's where it can get a little bit confusing because there's, under each of those options are so many choices. And so it just can get to be, a little confusing on that. So does that all make sense?
Thank you so much for explaining.
Oh, you're welcome.
So much more sense now.
Okay, good. Well, I feel bad. I should have said that at the beginning. So I'm glad that good. Okay, we're good.
I did have a question.
Oh, yes.
Is Optum still with United Healthcare?
They are still the mail order company is Optum, but then they do have the Optum primary care.
And that's when my doctor said, we've known each other for 25 years. I went, you're not leaving me, are you?
So Optum is, because Optum is connected, I know they have the Optum primary care and things like that, so they're still in the network. They do have an Optum, and United's kind of tricky. They have a Tucson Metro network and an Optum network, so they're still there. Fingers crossed. I could still look it up just to make sure, though. Just to make sure, but I'm pretty sure that Optum is there. Yeah, no, but it's good to check because that's the thing. You just don't know. So now I was going to transition to the healthcare marketplace. But does anyone have questions on the marketplace, or do you want to keep talking about Medicare?
I would love to hear about the
Marketplace. Okay, just want to make sure because I just want to make sure like everyone's good. Okay, so the healthcare marketplace landscape is changing for this year. It can be called healthcare marketplace, ACA. Basically, this is the under 65 health insurance that's offered right now that the government gives a subsidy for. But this is basically if you do not have group coverage and you need health insurance and you're under 65 for yourself or your family, this is where we go. So I will walk you through too how we do this, because also I have some clients that maybe one spouse is on Medicare, one is not. And so that's where this can kind of tie in together, is that if one is still on the marketplace, so we need to get them coverage. So usually the first step we would do for this is we would sit down and actually do an application for the healthcare marketplace. We put all of your family information and your income, and that would, in the past, it would generate a subsidy based off of your family size and income, and that subsidy then would be something that the government offered to help put the cost down on these plans. So when we talk about subsidy and things like that, it's all generated based on your family size and your income, and that would help pay for plans. So this new year for 2026, part of what's going on right now in the government is that these subsidies have usually they're renewed every year. And the open enrollment time for the healthcare marketplace plans starts November 1st and goes through the January 15th. So there's a little bit of time there. But this is where families that are on the marketplace, we go and we renew, we see what's happening. New plans come out just like they do for Medicare, and we check out those new plans and we see what works for you. Now we are at October 23rd and the subsidies have not been renewed yet. So usually they're renewed every year and that helps bring the cost down, but we just haven't had the renewal. So as agents, and even I've talked to a few different insurance carriers, I've gone to meetings, and at this point we're just kind of waiting to see what happens, what comes out. We're waiting for those new plans, so we don't have them quite yet. But that's what's, when people talk about the subsidy renewal and all of that, that's what that is, because some of the plans can get a little bit expensive. It really just depends on what you're looking for in the marketplace plans. But so that's premium and subsidy changes, benefits and plan designs. Oh, yeah. Did somebody say something? Oh, benefit and plan design updates. That again could be your co-pays, deductibles, and things like that to look at on the plans.
Can I just ask, open enrollment goes till when on the marketplace? Till
January 15th.
January 15th. So if there's no resolution.
So what I've been told, so here's what I've been told, because I have gone.
Someone's gonna have to decide something,
Right.
no matter what.
Right, and I've gone to meetings specifically for each of the carriers. What I've been told is that the carriers are preparing for this because they're going to have to offer plans that are less expensive. So that's what I've been told, is that the insurance carriers are going to adjust, but we're just waiting to see. So I have faith that it's going to come through, but we'll see what happens. So, yeah. And there are some new carriers coming into the market as well, and so that also hopefully will help. Cigna is now going to be in the marketplace. Banner Aetna is pulling out. So we're just going to see what happens November 1st when the new plans come out. But benefits usually for these types of plans will have a deductible, they'll have the co-pays. But again, it's very similar to how we do Medicare. Put your doctors in and your prescriptions in the system, and then I just start to look to see what works best for your family. If you'd like to have a lower monthly premium, then we might look for something with a higher deductible, but there's ways to kind of look around that and see. And then enrollment eligibility. If you are self-employed, maybe you're a 1099 employee, then you would be able to get the marketplace coverage if you lose other coverage. Or let's say you have a life change, and that's what happens when someone goes on to Medicare, maybe one spouse does, then that is considered a life change. So we can go in and do an application and say, okay, this has changed, this is where we're at, and that can open up an eligibility for that. Okay, sorry, I keep forgetting. I go back like I'm going to change it. And so this just kind of talks about the subsidy changes and the plan benefits. Okay, we can go to the next one because I think I may be louder. Okay. So some of the trends are we might have a few new carriers that come in for marketplace. And yes, the open enrollment is November 1 to January 15th. Okay, we can go to the next one. And this is just basic information. If you're on the marketplace, check your notice of change. Let's recheck your subsidy and see where you're at. Confirm hospitals and doctors just to make sure that those haven't changed. Okay, and then coordinating Medicare and ACA. So let's say you have one person going on to Medicare, or both of you are going on to Medicare with you and your spouse. Then the marketplace does not automatically end. So what we do is you keep that marketplace coverage in place, and then we start that Medicare Part A and B process. And once we have approval from your Medicare plan, then I would say cancel that marketplace, and so then you don't continue to pay that. But you do have to cancel it once Medicare starts. If you were to go and try and renew your marketplace coverage and you start going through your application, it would flag it and say, wait a minute, you're 66. You really need to go be on Medicare. So it would not allow us to keep you on an ACA plan or healthcare marketplace, and to avoid the double coverage and penalties. So, yes. Okay, and like pretty much what I just talked about, but yes, when one household member is enrolled in Medicare, the others can stay on the marketplace. So let's say your family's on marketplace and one person goes to Medicare, everyone else can stay on the marketplace plan. I've seen this happen recently. And actually, when we do that, it also regenerates. So they look at income. Let's say someone retires and the family's still on the marketplace. They go to Medicare. So what will happen is we report a life change. They recalculate with maybe a retirement income instead of the income they had in the past. And that will usually change, that could change the subsidy for the family. And basically, this is enrollment, appeals, and coverage. So Medicare and the ACA Marketplace have specific enrollment periods when you can apply for coverage and also when you can make changes. There are also appeals processes for both of those types of coverage. I'll say an example of this. I had actually a family member. She went in, she had a dermatology a surgery, came home. Before the surgery, she had a prior authorization. It was approved from insurance. 2 months later, she gets a bill for the full surgery, just like they had never billed insurance. So a family member, she calls me. I start to investigate and call the billing. I usually, because I have a lot of clients that will call me and like, why did I get this bill? So I call the billing department first at this doctor's office, and it turned out that the doctor that did the surgery was not in network. But when they pre-approved it, they pre-approved the other doctor. And so I was, they're telling, and it kind of took a little bit of digging to get to this, because I know who's in network. I can check those things. And so I'm like, I'm actually the insurance agent. So let's talk about this. And so what we did is I said, you need to rebill this, but you need to rebill it through the doctor that you pre-authorized. And so we actually didn't get to the appeal because I kind of stopped it right there. But there are processes. Let's say you get a bill and they did not bill correctly. So you can appeal it through your health insurance. And then there's also grievances that can be done through Medicare itself. These Medicare plans all have what's called a star rating. I don't know if everybody knows about those, but as you're looking through different plans, let's say you're on Medicare.gov or you hear of a friend telling you about a plan, if you look up their star rating, there's 1 to 5 stars. And those star ratings are based off of complaints to Medicare and complaints to the insurance companies. So if a carrier or insurance company has a lot of complaints, they will not have very good star ratings. So that's something to look at as you're looking at these different plans that are available. Yeah, I know. It is. It's like, and so the new star ratings just came out for next year, and I think Pima County has 2 4.5 stars. We don't have any 5-star plans here. So that will just tell you. So it's kind of something that if you're on an Advantage plan to take a look at, and just, it's based off of people that,
Individual plans like Cigna.
They all have them.
If you look up, I'm going to use United Health. If I Google United Health, will it list the stars?
Yeah, if you Google United, I would Google your plan name with the star rating, and it should be able to tell you for 2026, because they change every year. So is there any questions? I hope I covered everything. Does anyone have any questions for me?
Where did you say you find the star ratings?
So they should be at Medicare.gov.
Okay.
I also could look, I could look those up, but if you look at Medicare.gov, you should be able to see the star ratings. They were just released for 2026, or 2025, I would say maybe 2 weeks ago. So they just kind of come out, and they always come out after because it's based off of the prior year of any issues that were there. So, yes.
I was just wondering whether, you talked about how the subsidy issue for the marketplace depends on what's happening with the government. Are there any, I'm just wondering if the ACA includes any subsidies for Medicare as well that are somehow in play with what's going on in Washington?
I don't think Medicare is. I feel like the subsidy, or at least because they've already put in place for the Part B premium for next year. That's already happened. All of this, the Inflation Reduction Act and all of those Medicare pieces actually started in 2022. And every year they're rolling out a new piece. And so that has been more geared toward lowering cost, lowering prescription costs. And so that has already been in place. This is really based off of I think it's just based off of the marketplace itself. I feel like Medicare, the changes and things going on with that are more on utilization and all of that type of thing. All of the carriers that I've looked at, it seems to be that way.
I have a question. So under the ACA, if you are self-employed,
Yes.
is it a viable option if you have few employees or employees that you don't have to offer health insurance to? Is it a viable option? Or is it something that would not? I don't know.
So in comparison to maybe like a small group
Yes.
kind of coverage,
Yes.
I feel like if you have over 5 to 10 employees, then it could be an option to offer the small group. But I think if it's just a few, it's probably best to let them do the marketplace. I mean, it just would depend.
But I'm talking about for yourself.
Oh, for yourself?
Yes.
Oh, okay, okay.
Because premiums are very high.
So,
And I'm self-employed, I have my own business.
yes,
And the rates are just skyrocketing. And if
Yes.
you don't have employees, you can offer them other options. I'm just
Right.
curious if
There are
for that
some-
demographic.
there are some short-term plans. I think United Healthcare offers a short-term type of insurance plan that is off the marketplace. There are a couple other carriers out there that will do plans like that. They're not a long-term plan though. But I know this next year they're supposed to bring out some more bronze level plans, which on those, maybe the deductible is higher. But usually what I do is when I go in the system, I'll kind of play around with it because I'm on the marketplace too. My family, we are as well. And one child is off, but it's myself and 3 of my kids. And so, it can get expensive. And I know for myself looking at it, I have kids that play a lot of high school, college sports, and I did not want to have a high deductible. So when I get in there, we can filter it depending on what your needs are. And I was like, well, I'd like to do a 0 deductible. Let's see what that's going to do. And so I kind of play around with it just to see. But and I was able to find something that was actually okay. But it also just depends on what you're looking for. And so
Yeah, I think it has this stereotype for unemployed or no income or
Okay.
students, but I don't think that's true.
So that's actually not that, and what they will do, so let's say you go in and you do this marketplace application and you don't have an income or you're under a threshold, it will actually send you right to Access. And so I've had that too, where a family will apply and the parents then get put onto the marketplace, but then it sends the kids to the the CHIP program or a kids or an access program for kids healthcare. So once that happens, it actually won't even let you do marketplace if your income is within a certain limit. And I've had that happen with clients before. We start to look and it's like, nope, they have to go that way. And so what it will do is it will send their application to Access and then Access will follow up. So it just depends on their income. But that is hard if you've got a student or if you've got someone with a smaller, yeah.
Right. Thank you.
Yeah.
What is the income level?
Can I add something on that?
Oh, yeah.
Hi, my name's Stephen, I'm married to Cisa. If your small company is a technology company, or you can splint that in, claiming that you're a technology company, Arizona Technology Council has an association health plan through Blue Blue Shield. So you can be single employee, you can have 3 employees, you can have 12 employees, but you can basically buy into a pool to give Blue Cross Blue Shield to those employees rather than go on the exchange. So
Okay.
it's an option that's out there.
Thank you. Yes, yeah.
Are the marketplace plans credible coverage?
Yes, they would be credible coverage because there is that transition from the marketplace to Medicare, and so they would be credible coverage. What would not be is maybe like I've seen where someone has maybe a discount drug plan or something like that, and then on top of all of these things, there are extra options. Maybe you get a marketplace plan and you still need dental. So I know someone like myself or other brokers, we have standalone dental plans or vision plans or things like that that you can add in. And also what I've noticed with some of the premiums being higher and some of the higher copays, there's a trend now also where you can pick up maybe a hospital plan or a cancer protection plan, and maybe you're paying $30 a month to have extra hospital coverage. That's also something, let's say you're self-employed, maybe you're a hairdresser, and so if something happens and you're in the hospital and you can't work, and that is, you could maybe get one of those hospital plans that would pay for your medical and also give you money for when you're not able to work. So there's other things out there too.
So I thought in the marketplace there were HDP plans.
HDP.
What? High deductible plans.
There are high deductible plans.
So would an HDP qualify as credible coverage? Because that's going to not necessarily meet the threshold of the drug requirement for meeting or bettering what Medicare offers.
Well, I think the high deductible plans are more coming out this year, and I know that there are going to be HSA plans this year. I would have to look at that and see.
Sorry.
No, that's okay. Those are good questions because that's something that, I mean, I feel like if you're on the marketplace, then that should be considered credible coverage, whatever it is, because if it's going to go into Medicare or if you have that. But then again, if you're going from ACA to Medicare, then you can't stay on that so it may be, we'll have to look at it and see. Yeah, no, it's a good question. And yeah.
So kind of a three-part.
Uh-huh.
I'm minutes away from wanting to switch from Humana to United.
Okay.
Which in many ways seems like a lateral move.
Okay.
One, would I have to wait until January? Or are you saying that November to January is my time?
Are you on Medicare or
Yes.
Marketplace? Okay, so Medicare enrollment period, October 15th through December 7th is the time for Medicare. The November 1st through January is actually just Marketplace. So that can get confusing because they're two different timelines. So for Medicare, October 15th through December 7th, and then your coverage would take effect January 1st. But there's also another time to change that we're not allowed to advertise. January 1st through the end of March is they're allowed to change again. So let's say you make a change during the annual enrollment period. It's October, you're like, okay, I see a commercial, I want that. January 1st starts and you're like, why did I do this? I'm not happy with it. They give you one more time to make another change that time. So
That was the second part of my question.
Okay.
You say that, do you think that Humana will be angry at me and will later say, she can't come
they
back?
can't do that. So that's another thing. Medicare,
So they don't look unkindly on those of us who have a change of heart.
and honestly, Medicare there's no pre-existing conditions. They don't look at anything like that as far as option 2 on a Medicare Advantage. Option 1, like I said earlier, if you try and go to that later, they will underwrite you and give you health questions. But Medicare Advantage, there are no health questions. There's nothing. You can change 1 year. You can go back. I have a couple clients that they really are into the dental work, and maybe 1 year they want to use this $5,000, and then next year they want to go get, so it's all just based off of what you want to do.
Switching internet carriers, isn't it?
It can be, but then honestly, most people just, if they're happy with it, that's the other thing. If you're happy with what you have, you do not have to do anything. So you don't have to, like if you walk into a Walgreens and you see a kiosk or somebody or a Walmart, you don't have to make a change. If you are happy with your plan, you don't have to do anything. So know that as people are calling you and you're walking around, you don't have to change if you're happy. So yeah, you're welcome. And if there's any other questions, I'm happy to answer those individually. And I hope that I covered everything and we're all good. I'm like, I hope I got all of it. But please let me know. And I really just want to educate and make sure you're all happy where you're at. So yes, thank you. Thank you.